Good afternoon. My name is Stephanie Clark, and I'm here to present our project proposal. We are here today to discuss Doctors Hospital, which is located in Central Ohio. This is a 300-bed medical center, which is part of Ohio Health, which is one of the largest health systems in Central Ohio. It is a level 2 trauma center with a diagnostic cath lab, a women's center, labor and delivery, and NICU. It is considered both a suburban and an urban healthcare facility, as it's easily accessible by all populations. In the fiscal year 2019, it treated 1.5 million patients, and this year it's projected to see about 5 to 10% more. The average charge for a basic hospital stay is about $400 a day. Payer mix is about a third Medicare, a third private insurance, a third self-pay, and 1% indigent care. A survey recently conducted revealed some patient concerns around communication delay in results. It's been reported that patients have to bring their own paper records. Duplicate tests are being performed because results weren't available. Interdepartmental communication is a challenge, and an inability to communicate information pertinent to patient care results in delays in test results. Other concerns voiced relate to dated and cramped facilities. Physical access related to parking is a challenge, and staffing and supply chain issues are also a concern. It is our proposal that integration of electronic health records must be done for continued growth for Doctors Hospital. The path to improve data-driven outcomes is likely to be, at least for the foreseeable future, through electronic health records. In order for a successful integration of electronic health records, tech infrastructure must be analyzed to ensure internet bandwidth will support the new technology. Additionally, ensuring the correct hardware and software is in place. Communication with key stakeholders to ensure there is buy-in will support a significant change, as well as consideration for training and continued support is something that needs to be considered. Benefits of integrating electronic health records include better coordination between multidisciplinary teams. Electronic health records can help guide clinical decisions and higher quality outcomes. All providers will have access to a patient medical record. Therefore, communication between providers is easier and coordination of care is easier. Additionally, 72% of patients report an improvement in communication with providers once EHRs are integrated. Clinical decisions become easier for providers. Real-time test and procedure results help providers make decisions more easily and more timely. And the quality of care delivered is improved with electronic health records. Reports and quality data can be generated. Clinical tools can help providers deliver that high-quality care. Public policy aspects of electronic health integration. Despite benefits to electronic health records integration, there is concern with patient privacy and security of private health information. HIPAA mandates security of all PHI on paper and electronically. Breaches in EHR security could result in HIPAA violations, and organizations can be faced with fines and legal implications. Providers must be vigilant with aspects of EHRs and the potential for security breaches internally and externally. For example, internal breaches of EHR can result from a coworker accessing a patient chart due to a provider not logging out. External breaches result in malware, hackers. Additionally, healthcare organizations need to be aware of the potential threat the potential theft of certain devices. Another aspect of EHR integration risk is incorrect or incomplete data. Documentation errors, such as documenting on the wrong patient, wrong information, inaccurate information, can all result in medical malpractice and legal liability issues. Government incentives for electronic health integration. The high-tech law that was initiated in 2009 is a $27 billion incentive for electronic health record integration and use. For example, a provider with a third of their patient population that's covered by Medicare are eligible for about $44,000 in total government incentives. However, if they demonstrate meaningful use of electronic health record use, they can earn additional incentive up to $63,000. Meaningful use would be demonstrated through e-prescribing, quality data collection, and the ability to collaborate between providers and facilities. Quality data is more easily retrieved and can be used to drive quality improvements, improve communication between providers, improve time management, since centralized chart management will have results right at your fingertips, and improved patient safety. Aspects of care like medication formularies, lab results, and images are all readily accessible. Long-term cost reduction is the estimate that an organization can recoup their investment of EHRs in about 2.5 years. In addition to that, it is estimated that $23,000 per employee is net benefited, resulting from as a result of the above: time management, communication, patient safety. However, we have to consider the high cost to integrate and implement, ensuring the proper infrastructure is in place that would support EHR. There may be a cost in updating all that. The initial investment could be quite pricey, and there could be continued costs throughout the life of the program. Training and education can be costly as well. I've included a little figure here, just kind of demonstrating the upfront cost, the yearly cost, and the 5-year cost to own, just to kind of demonstrate how costly it can be over the life of the technology. Lastly, why does EHR integration make sense? EHR integration can improve timeliness and accuracy of care, despite the initial investment and long-term cost of electronic health records. Government incentives can help offset costs. Additionally, savings can be demonstrated through savings over time, patient safety, and quality improvements. I sincerely appreciate your time. If you have any questions, concerns, just please let me know. I'm happy to answer them.